So, Dr. Yash, I think we can start.
Just a minute, just a minute.
Yeah, yeah,
Uh,
yeah.
can you see me?
Yeah, I can see you. So
Okay.
hello everyone, whoever is joining. So this session I have specially organized so that we can guide you for the final month to give that extra push. And I'm very thankful to Dr. Yash Jain as well, who was 2024 NEET SS AIR1, who is currently pursuing MCH Surgical Gastro at GB Pant, Delhi. So I think Yash, you are very occupied with your work, and thank you so much for joining for this. So I'll quickly go to you, and I think I'll just take your quick inputs regarding this last month about what students should be doing it. What is your tips and tricks and strategies to be done in the last 1 month? You can just take the floor and give your tips so that the students who are listening can get advantage of that.
Uh, yes, yes. First of all, thank you, Dr. Ruchi sir, for inviting me in this platform. So I'll jump straight to the topic. Sorry, pardon me, I'm traveling right now. I'll jump straight to the topic. So I'll divide my talk into two parts. In the first part, we will talk about tips and tricks and how one should go about in this 1 month, which is left for NEET SS, exactly 1 month. And in the next part, I'll talk a little bit about the mentality that you should have in the last 1 month of the preparation, because at the end of the day, it is a mental game. So let us first see the first part is how to go about in this 1 month. Like a lot of people ask me that is my audio okay?
Yeah, audio is clear. You can go ahead.
Okay, okay. So a lot of people keep asking me that how they should revise or what should they cover in this last 1 month. So now in the last 1 month, I would say divide this 1 month into two phases. It can be 20 days, 10 days, 15 days, 15 days, whatever. So in the first phase, start start looking at those weak topics that you have. Like you can be weak in super subjects or neurosurgery or plastic surgery. So in the first phase of this 1 month, take the time to determine your weak areas and try to cover those loopholes. How you can determine your weak areas is by giving more and more GTs and giving more, practicing more and more MCQs. So in the first 15 days, first 20 days, you target your weak areas. You give a GT, whatever is your bottom three subjects. It may be neurosurgery, it may be plastic surgery, neurosurgery. You cover them because because let's face it, the exam is not, even if you want gastro surgery, the exam is not going to be about gastro. It is going to be about all the subspecialty. It will cover every subspecialty, and the weightage is going to be equal for all the specialty. So you cannot have any weak areas if you want to score good. If you're good in great in gastro and you know nothing in plastic and CVTS, so you won't be able to achieve such a great result. So in the first 15 days, 20 days, plug those loopholes. Try to determine which zone you are weak in. You can be weak in general, you can be weak in trauma, whatever the subject is. Try to focus on those subjects. Now you can do that by solving more MCQs regarding that subject, or you can revise the class notes that have been given to you. Don't watch videos that will waste your right now because of the last 1 month. Go through the revision notes, go through the MCQ practicing of those subjects. You can also revisit those subjects in Savistron or Bailey, wherever you have read it from in the first place. So try to plug those loopholes that will help you in maximizing your score. Now, second thing is in the last 10 to 15 days. So those who have done their preparation well, they can take last 15 days. Those who have a little bit lacking in the preparation can take last 10 days. Now this last 10 days, 15 days, you try to focus on certain things like tables and figures from Savistron and Bailey, because those are very high yielding things that are going to come in the exam. Then previous year's questions. So they might not repeat the question itself, but they do repeat the concept related to that topic. So previous year's questions are very important. I want you to give time, give the time they deserve while solving previous year's questions, not just finish them off in one day. Just give them time. So previous year's questions, tables and figures from Bailey and Sabiston. And then third thing is whatever GTs that you have given till now, made from any platform, you have given Sushruta Decathlon series. So you must have bookmarked certain questions you would have gotten wrong. So revisit those questions, because a lot of questions in the real exam do come from these GTs. And these are the questions you have got wrong in your while solving GTs. So you don't want to get them wrong in the real exam. So third thing is revisit those GTs. Now, while doing these previous year's questions and revisiting these GTs, you can also, the fourth thing is you can also revisit the MCQ bank also if you have bookmarked certain questions. So these are the four things I want you to do in the last 10 to 15 days. I dedicated my last 15 days for these four things. Like I solved tables and figures from Saviston Bailey, and then I revisited my previous year's questions and revisited those GTs, the mistakes I have done in those GTs. And also what you can do is you can write them down after revisiting. Also, if you are having a doubt that no, I might not remember this information during my exam, you can even write it down and you can study them one day before the exam. I even tried and did that also. So like while revisiting those GTs, then I thought that this question I might not remember for my exam, so I wrote it down, and just one day before the exam I just went through it. So give those last 10 to 15 days to this preparation also. It is very important. And it is another thing I want to talk about is it is very easy to get distracted by looking at people around you, especially in the last 10 to 15 days. You would think that that guy is doing this, that guy is doing that, that guy is reading swords now. I also should go and revisit those topics. No, you focus on your preparation. Try to isolate yourself. It is very important, बिकॉज पीपल डेविएट फ्रॉम नो ये नहीं करता वो करता हूँ उससे शायद क्वेश्चन आ जाए वो बंदा वो कर रहा है एंड देन they are neither doing this perfectly nor doing that also. So try to focus on this. So this is how you should go about in the last 1 month. What do you think, sir, Ruchir sir?
Yeah, that is what I'll be also covering more in detail, going into slight more detail, but that is very aptly summarized by Dr. Yash. And I think that is also the key to success in NEET SS, because it is all about the strategy right now in the last 1 month, rather than thinking about and procrastinating about the subject, the course, and everything. And another thing I wanted to ask you so that you can guide is regarding the last week, or in more importance, I want you to tell them about the exam giving strategy, because you are the one who has given in the time bound section base that it was implemented last year itself. So just give your quick tips about what could be done for them to give it efficiently, because the pattern is very challenging, because many students have been asking me and giving me inputs about the same. So just guide them through that what is your some tips or some tricks about the same.
So yes, like I said, it is also about the mental game. So I'll talk a little bit about giving the exam, the real exam. Is uh, I will be frank with you. I only studied Bailey and Saviston, and there are people studied Swartz, who have studied Shackelford, for that matter. And so let me tell you that it doesn't matter what you have studied. Like, of course, you would have to study the basic books like Bailey and Saviston, but it doesn't matter how much you have studied. The all thing that matters is how much you can reproduce in the exam. The exam is not about cracking those one-off MCQs, very tough MCQs. It is all about doing who does the less silly mistakes, who is able to recollect during the pressure of the exam, the 1.5 hours of pressure, and then you have to recollect, and you have to do 150 questions in one go. So who is able to recollect under that stress? The exam is going to be about that. So during the last 1 week, like I said, go through your tables and figures, the high yield things, Go only read about high yield things, the previous year's questions. These are very important. Now, in the exam, there is time bound section. You have time for each sections. Then those who are aiming for a very good rank, like a rank of top 50, top 100, I would advise them that go aggressive in the exam. Give yourself a chance that uh, to gain that top 50, top 100 rank. So I left three questions in the exam, one in each section. So try to be aggressive. So don't leave more than 5 questions. I would say if you want to be top 50, top 100 zone, go against the exam. The exam has one fourth downside and upside is +4. So go aggressive. That is very important. Second thing is, even if you don't know anything about the question, try to read the questions thoroughly. Try to come and revisit the questions later on in the exam, and try to think that, oh, what how you can eliminate these options. There are four options. Try to eliminate at least two options, and then you can take a bet between the remaining two options. So that will be a 50-50 chance. So even if you don't know, like we had a question on cerebral microdialysis. So even if you don't know about the concept, try to read the options properly. You might recollect something, or you might take a clue from the options, which will help you guide to the correct answer. So take that risk, and in the exam, if you leave more than 5 questions, then I feel like you are out of that. If you are aiming for a top 100 rank, if you are aiming for a top 300, top 400, then it's fine. Then you can take a little bit less risk. But if you are aiming for the top 100 rank and top 50 rank, and definitely a top 10 rank, then you should go aggressive on the exam paper. Try to take hints from the exam paper. And the questions are going to be lengthy. You should have prepared for lengthy questions during your preparatory phase also. And in art, yes, the questions are going to be lengthy. So just go through the options quick, and then try to recollect those yes the facts as soon as you can.
Yes.
And
Yeah, so I think you have very aptly, and also the main highlights what I wanted you to tell, you have already highlighted them. So I think if you have quick 5 minutes, we can take questions if
yes,
students
yes,
want to
yes.
ask you before I move on to my session. So if the
So,
students have any,
just
yeah,
give me 2 more minutes. I'll talk about something about the
yeah,
mentality game, and which
yeah,
has really helped me also
yes,
during the
yes,
reparative phase. So,
yeah,
see, it it really doesn't matter कि आपने अभी तक कितना पढ़ा है, आपने कम पढ़ा है, ज्यादा पढ़ा है, आपका अभी जीटी में 100 रैंक आ रहा है कि टॉप 10 रैंक आ रहा है डेकेथलॉन सीरीज में, आपका 500 रैंक आ रहा है. Believe me, the third ranker is with me right now in GB Pant, and he never scored a top 100 rank in any of the GTs that he gave.
yes,
तो आप कुछ फर्क नहीं पड़ता है कि आपका अभी जीटी में कितना रैंक आ रहा है, कितने राइट्स. The only GTs that is the GT that is going to matter is the real exam. So
yes,
ये 1 month is a make and break. It is actually a make and break. It can like save 1 year of your career. To be frank, like I have known people, like after I met a lot of people who have just studied for the last 1 month and cracked a 100 rank, cracked a top 150 rank.
yes,
I know such people. So आप ऐसा मत सोचिए कि नहीं मैं अभी तक पढ़ा नहीं हूँ या पढ़ी नहीं हूँ. I have not started preparing. Even if you have not started preparing, this 1 month can make and break. I'm telling you. And even if you are in the top 10 rank, if you get overconfident कि मेरा हो गया है, I'll achieve it, मेरा rank आ जाएगा, no, it is not going to work. You have to be very aggressive in this last 1 month. Isolate yourself from any from outside distraction. Just focus on your studies. Study for 12 hours, 14 hours, 16 hours, whatever time you can. It can actually like help you get a very good rank. It is not about who have studied more swords or who have more studied more Shackleford. It is the exam is not about that. The exam is who can keep a calm mind, who can make less silly mistakes, and give Joe questions, and who can make more right. So yes, so work on your mentality. before the exam, go for
Yes.
like at the start of the exam when the timer goes off and you are waiting there in those 15 minutes, try to recollect, try to reinforce in your brain, no, I have done this, I have done this hard work, the hard work that it deserves, the exam takes. I have done the hard work, and you have to picturize yourself getting the rank. So positive reinforcement to yourself. Don't get overconfident. Don't get me wrong. I'm saying mentally picture yourself that yes, I can do this, I have done this, and मैंने इतना मेहनत किया है, मैं यहाँ तक आया हूँ. Picturize your मेहनत, picturize your hard work inside you whenever that 15 minutes that you have before the exam. Try to do some box breathing. It calms you down. I actually did box breathing in those 15 minutes. It calmed me down. It helps you recollect those facts which you have already studied. And yes, and the exam, like, you will be able to crack the exam.
So, Dr. Yash will take some questions before you leave. So, one thing which I wanted to ask you was about the tips for the exam, about the time-bound section base. There is a very specific question about how much time they should be keeping at the end of every section for revision, and if to review all the questions or only the left or bookmark, which I will also advise them to keep minimum of 10 to 15 minutes at the end and review only the one which you have left or bookmarked or flagged, and don't flag all of them which you have confusion, because you'll unnecessarily change the answers at the end. So that is my advice. Now, Dr. Yash, what would be your advice for the same?
So like in all the exam which I also followed is, जब आप जा रहे हैं, so एग्जाम में दो डिफिकल्टी तीन डिफिकल्टी के क्वेश्चंस रहेंगे.
Yeah.
एक जो बहुत इजी रहेंगे, जो आप तुरंत बता देंगे आंसर, लाइक एक क्वेश्चन पुट हुआ, इट इज इन योर रिफ्लेक्स, तुरंत एक आंसर आया एंड यू नो दिस इज द आंसर. ऐसे 50 में से ऐसे 30 क्वेश्चन ऐसे रहेंगे, या 32 35 क्वेश्चंस ऐसे रहेंगे. देन बाकी के सेकेंड लेवल में क्वेश्चंस रहेंगे विच यू वुड हैव टू रिकलेक्ट. 10 क्वेश्चंस वैसे रहेंगे जो आपको रिकलेक्ट करने में टाइम लगेगा. तो पहले ना आप जो जो भी जितना जल्दी हो सके ये लेवल 1 के क्वेश्चंस निपटा दीजिए. सो यू हैव इनफ टाइम एट द एंड, लाइक फॉर दैट लेवल 2 questions, and then give time to those level 2 questions. Don't book, like sir said, don't bookmark unnecessary every questions की नहीं यार ये doubt लग रहा है मेरे को, इसको bookmark करो चलो आगे बढ़ो. No, don't do that. You won't be able to revisit your bookmarks. So first go through all the 50 questions जो तुमको directly मुंह पे आंसर आ रहा है in your reflex arc. The answer those questions जिसमें तुमको लग रहा है नहीं इसमें थोड़ा सोचना पड़ेगा, like उन्होंने हाँ इसमें थोड़ा सोचना पड़ेगा, इसमें थोड़ा टाइम लगेगा. रिविजिट दोस क्वेश्चंस लेटर ऑन एट द एंड, आई वुड से.
Yeah, so for the exam giving strategy, like I was going to cover it, so you have to try to give 40 to 45 seconds per question, leave 10 to 15 seconds every question for revision. Try to follow it. And as Dr. Yash mentioned, that you have to bookmark only the ones where you're very unsure about more than two options. If you're getting confused in two options, and whatever first instinct comes to your mind, you should mark that, and do not bookmark all the confusing or the difficult ones where you feel that I need to go again, because sometimes you will change the answer. So the exam giving strategy, what will also be very important for you to understand is that you need to be aggressive and you need to properly manage your time. So I think Dr. Yash is occupied. So I think we also
No,
have
no, I am here. I think we
yeah,
can
yeah,
have a
yeah, yeah.
question answer section.
Sure, sure.
Yeah.
So another, like also we have Dr. Ayush here, who is also a faculty for neurosurgery and a top ranker in the NEET SS 2023. So Dr. Ayush, you can also pitch in for the various questions. So starting with one of the question is about the what things to be avoided in the last 1 month. I think you have pretty much covered it. Very important question is to how to prevent burnout if you have been grilling since last 3 months. So that is something both Dr. Ayush and Dr. Yash can answer about what you need to do to prevent burnout, because that is something which everyone has faced in the last 1 month.
So
Yeah, you can, Dr. Yash, you can go.
so
Yeah, go ahead.
yes, yes. So again, this is where the mentality which I was talking about comes into picture. That Like the toppers, they do get burned out that saying कि यार मैं 6 महीना से पढ़ रहा हूँ and अभी और 1 महीना. So to them my advice would be, you have come this far. It actually takes that last 1 month. You have to grind it. You have to prepare yourself mentally. You have come this far. You're getting a good rank in GTs. You can do it. Just keep going for the last 1 month. And to the people who are like below in the rank and they are like मेरा नहीं होने वाला है and I think I should just अभी नहीं होगा मेरा, आई शुड जस्ट क्विट और मे बी नेक्स्ट ईयर देखूंगी. ऐसा कुछ नहीं होता. लास्ट 1 मंथ इज वेरी क्रूशियल. This is the time when most of the people they burn out and they give up. But and the one who perseverance, who has the perseverance, do get the final rank. So my advice to all of the people would be, this last 1 month can actually save last the next 1 year of your life, and also can get you your dream branch. Like I always wanted to do gastro, and now I'm able to do gastro surgeries. So the feeling is unparalleled, and yeah, you will get the results and you'll get the benefit of
Yes.
keeping going on. Just keep going on.
Yes. Yes, Dr. Ayush, what is your input regarding this question about how to prevent the burnout if you have been preparing since last few months?
Yes,
Your
so
inputs on the
I
same.
absolutely agree with Dr. Yash. So with that, I would only share with my experience. Like I gave the exam in 2022 and 2023. So I had this experience of burnout in 2022. So what I changed my strategy from 2022 to 2023 was that I stopped running after new things. I think that is one major thing that we
Very
all
important
make a
aspect,
mistake,
yes.
right? And that is what is going to make you burn out, because what you are going to realize that many GTs are going to give you some good questions. You'll be like, oh my God, I don't know this. So what we do is that we start running after them, as a result of which we overburden ourselves. So I think that is very important that we don't do this in this specific last 1 month. It's important that we stick to what is important and keep revising. I think it is important to revise what you know than to run after what you is good to know, because that's not going to help you, and that's only going to add to your workload and you are going to feel burnt out, right? And also another thing is like the GT scores. So I still remember, like just before a month of my GTs, I was getting around score of 215, 260, and I was like very disappointed, like what is going to happen in the main exam. But the point is, all GTs are framed differently. So you should still keep going, practicing, not thinking of the score, keep improving on your bad sections rather than overthinking that why I'm doing wrong. And I'm sure it's going to help you in your main exam, because that's what happened with me. Like in 2022, I was like overthinking. In the end, I messed it up. On the next year, I changed my attitude approach. I kept on giving my GTs, and as a result of which, I remember the last GT which I gave, it automatically improved my score to around 375, and that was my final score to get me a rank of around 700 something, which was good for me because I wanted neurosurgery, right? So everybody should not be aiming like everybody cannot come first. This is a competitive exam, so just don't run after your rank or something. Keep improving, right? So if you start focusing on improving, I think that will help you to avoid burnout. Stop thinking what others are doing. If you have read something, trust your resources and sources rather than like trying to run after new sources and getting a pile of things, because that's not going to help in the end.
Yes, definitely. That is a very important point which you have mentioned, Dr. Ayush, that you need to be focused on your revision, your preparation, rather than thinking about that new topic or feeling the FOMO of reading new things. Just keep on revising, because I have been saying it since last few years that revision is the key to success in NEET SS. So moving on to the next question which students have asked is that many students are asking about the ideal number of mock exams to be given in the last 1 month. I personally recommend minimum of 5 in the last 1 month, not more than that. What is your input, Dr. Yash, regarding this?
So, so in this case, my point is different. I go aggressive with GTs. So, like in the last month, I used to do 2 GTs in a week, and in the last week also, like just before GT, I did two. I gave 2 GTs. So, like the exam was on Sunday, I gave a GT on the previous Sunday, and then in a Wednesday, and then in a Friday, I gave a GT. I'll tell you why. Because what people tend to do, and don't do this, what people tend to do is they don't solve GTs just the week before the exam. Don't do that. That is a bad strategy. Okay. If you are fearful, then मेरा score कम आएगा and just exam से
Yes.
पहले मैं मतलब मेरा कॉन्फिडेंस लेवल गिर जाएगा? नो. लाइक आई सेड, द ओनली जीटी दैट इज गोइंग टू मैटर इज द एग्जाम. What I would recommend is give a GT. Why? Because you have given a GT last Sunday and then directly you are giving MCQ, another GT, which is the main GT, the real exam. So अपना brain वो start नहीं होता है. Like even if you have given a lot of GTs, अपना brain वो start होने में, वो inertia, वो
Yes.
फ्री होने के लिए टाइम लगता है ना. तो इसीलिए 2 दिन पहले बिफोर द एग्जाम गिव अ जीटी. So if you have been getting a good rank, you can see the rank of that GT also. You can see the score of that GT. But that GT is not to see your score. That GT is
Yes.
to be in practice.
Yeah.
Like आप अगर कोई एथलीट को भी देखेंगे तो अगर कोई कल का मैच है तो इसका मतलब ये नहीं कि वो एक हफ्ता पहले मैच खेलेगा उसके बाद बंद कर देगा, है कि नहीं. नहीं, वो हर दिन प्रैक्टिस करते हैं ना. तो वो
Yeah.
एमसीक्यू का प्रैक्टिस, वो इनर्शिया जो है वो लूज, वो मोमेंटम जो है वो लूज नहीं होना चाहिए. तो
Yeah.
डोंट डू दिस. डोंट बी फियरफुल ऑफ जीटीज कि संडे को दूंगा मैं और उसके बाद नहीं दूंगा, बंद कर दूंगा. ऐसा मत कीजिए. डेली मैं last month, like I said, 2 GTs in all the weeks, and the last week I gave even 3 GTs. So that is a
Yeah.
bit aggressive on my part because
Yeah.
I was a little bit confident about my preparation. I wouldn't recommend that to everyone,
Yeah.
but like you know where you stand right now. So if you are in the top 20s, go aggressive on the GT. If you are in the 20 to 100 or 200 rank zone, go twice GT in a week. If you are in below that zone, then go give at least 1 to 2 GTs per week,
Yeah.
definitely.
So I think for mock exams, I think it is a very personal choice on what you are going to react to the mock exam result and how you are going to get affected by it. So I think it is a mix of 5 to 10 GTs in the last 1 month. It needs to be very carefully planned by the student. That is the reason why I told that in the last 1 month, more than what to read, it is about how to read and how to prepare. Uh, so Dr. Ayush, I think I'll
And
come
what
to,
you should
yeah,
not do, just a minute, what you should
yeah.
not do is not give GT at all in the last week.
Yeah, that is the worst thing to
That
be
is the
done. That if you
that is the
avoid
worst
doing
thing to do.
GTs, yeah, because
Yes,
many students who have been preparing or who will start now, they'll think that I have not read why to give GTs, but that is not the case. The
that
mock
is
exam
not the case.
specifically is practice not just about how to give, but also getting accustomed to the pattern and also understanding that how you're reacting to any tough questions. So coming to the next
Yes.
question, Dr. Ayush,
So,
because I
I would like
think,
to
yeah,
add one thing
yeah,
over
yeah,
here. So, like, I absolutely agree with what Dr. Yash told. So, but what I did in my GT, so like, I don't know if I'll be able to show or not. So, like, something, this is what I chart I had maintained, right? So, I would actually recommend that it's just not about giving GTs. You also need to
yeah.
know how much correct you are doing, how much incorrect you are doing, what you are leaving, and what is your score. That is going to help you in better to analyze like as you proceed towards the exam. So as he told that even giving GTs just before a week of exam is absolutely helpful because it might help you to even come down to your some weak topics which you might have been missing so far. Sometimes there are some topics like the clean wound, clean contaminated wound. We have read it so much we feel that we know it. But when the question comes in the exam just before a GT, you feel that you have messed it up. Why? Because we have forgot to revise those basic things. So the GTs are actually going to even help you to find out that. So rather than focusing on like what was the abnormal question that you are not able to solve, it will help you to recall that key, yes, oh my god, I need to revise this basic topic of clean wound examples, clean contaminated wound, and those 5 to 10 questions if you get in your main exam now, that's going to make a huge difference because those are the questions which everybody is going to get correct. You making mistake on them, you are going to move around 10 steps back. So it's better to like get those particular questions at least secured. So do maintain a chart also as like what how many questions you are getting correct, incorrect, how much you are leaving, because even you need to know what's your accuracy rate, right? Like just about attempting whether you need to attempt 150 or you need to attempt 100, it also depends upon your accuracy because sometimes you need to go with what the entire all the candidates do. So just you need to know like where you stand with your accuracy as well.
Yes. So I think the analysis of the mock exam will play a very important role, which I've been saying it since last 6 months. So please make sure that you practice and you understand and analyze your mistakes, work on them as already we have discussed earlier. So coming to the next question is about the reading of new Sabiston. I think Dr. Yash, you can pitch in, and Dr. Ayush also you can pitch in because you were You were the batch, I think, wherein you had the Bailey 28th edition updates. So both of you can pitch in about the reading of new Sabbathson edition. I'll just input about my opinion is that because I am preparing the updates from the 22nd edition, there is 15 to 20% new additions, but I feel that majority of the chunk is same. So you should not waste your time reading everything. You can just go through the updates which I'll be providing. Over and above that, don't think about what is going to happen about the new edition updates and everything. Just concentrate on the basics and revising what you have read, because majority of the things in the surgical field or the subject of general surgery is going to be same. The changes will be either in some minimal invasive technique or in percentage, or if some trials are added for GI cancer. So that are the things which you need to focus on. So coming to Dr. Yash, just quickly about the reading of news habits and the FOMO which students are having right now.
So I would like you have covered pretty much well. I would just stick to my previous advice that you can maybe you have that FOMO, or you are preparing so well, and now you don't want to leave any loopholes in your preparation. You can go through those updates which sir would be providing. The CRIPS update, you can see those updates. But stick to basics, stick to revising what you have already studied. Don't go after reading the book right now. I think that would be worst strategy. You can go through the updates and the revision notes, I think.
Yeah. Dr. Ayush, your inputs on this?
So I think when the 20th edition had come, we had sufficient time. It was quite early, not just before
Yeah.
the exam. So
Yeah.
this is one important thing that people should know, that when the new edition was launched, we sufficiently had around more than 5 to 6 months. So it was, even if I had wanted to read, I had enough time to read it compared with my previous edition and re-revise it. So if you cannot read it, there is no logic of starting something new. So I would again recommend, as even sir had told and Dr. Yash told, that go for the updates because those would be concise. Reading the entire book again is not at all advisable, because at before 1 month there is no point, right? If somebody is preparing for next year, you should definitely go to the new semester. But for time being, just before a month, it makes no logic, because at no point you are going to complete it, and then as we have been discussing, you will be having a burnout. So I don't think so there is any logic of reading new Sabiston. Stick to your old Sabiston, as sir has told. If you have read, it's almost 80 to 85% similar. 15 to 20% might be difference, which sir would be giving in form of updates.
Right. So
And
another
I
question.
think here
Yeah.
also just so
Yeah.
smart. You have to be smart in your study in this case. So if you're aiming for a top 20 rank, top 50 rank, and maybe top 10 rank, and you don't want to leave those loopholes in your preparation, go with it. Don't read the book right now. Go through the revision topics. Go through the notes that sir will be providing. If you're aiming for a top 300 rank or 500 rank, then I feel like revision and going to the things that you have already studied right now would be a better strategy than going after the new
Exactly.
edition.
Exactly.
And
Definitely.
So
just
this
one
is
more
Yeah.
thing.
what you want out of the exam.
And
Yes.
one
What do
more
you
thing.
want out of the exam? What do you
Yes.
rank do you want?
Agreed. And like as I told, if you're actually aiming for top 20, then the best thing is to go for the new tables and the charts. More
Yes.
visual thing rather than going for the text. I think that would be even much more.
Yes, definitely. So tables and images play a very important role in the revision, which I have also emphasized a lot during the last 3 years. And also right now I'll emphasize on that. So coming to the next thing is question is about balancing between theory, revision, reading, solving MCQs and solving mocks. So how should they do it? How to balance all of this together? Dr. Yash, I'll start with you on this question.
So I am very clear on this. Like I got to know about this strategy some 2 months before my exam, and I was lucky that see you have to realize the आपको कितना भी अच्छा आता हो जनरल सर्जरी, आपको कितना भी अच्छा गैस्ट्रो आता हो, आपको सारे प्रोसीजर्स आते हो गैस्ट्रो के, if you are not able to do right in this MCQs, if you are not able to apply those concepts, आपको कितना भी आता हो, it is not going to materialize in the exam. The exam is going to put a question, give you four options, and ask you which is the correct answer. So, so you have to keep your practice such that मतलब वही pattern में you have to keep practicing. So I would say last 1 month, those who have prepared really well and they are good, go with 50-50% division of your time. So in the morning, like what I used to do is start of the day only I used to start solving MCQs, and in the second half of the day I used to revise those loopholes, those weak topics, so that I almost gave 50-50 to solving MCQs and 50% to reading theory. So my take on this is go aggressive on the MCQs. Try solving as many MCQs as you can. Even try solving 150 to 200 MCQs daily. You can do that. It is possible and people have done it, and I think you should do that. And definitely for someone who think that no, my theory thoda lack kar raha, I need to focus on theory, try solving definitely 100 MCQs per day. That
Yeah.
is a must. Solving less than 100 MCQs per day would not give you a good rank, uh, for sure, no matter how much you read.
Exactly. So that is something also what I have emphasized a lot during this last few months, that MCQ practice, mock exam practice, and theory revision needs to go hand in hand. So before I give my input, Dr. Ayush, you can just pitch in on this.
So what I used to do for my thing is like even I used to start my day by solving a GT. So normally the exams are held between 9 to 12 or 10 to 1. So I used to make sure that I give my exam at that time so that I am actually oriented and well versed during that time solving MCQs. And once my exam was done, I used to analyze which topics are weak. So for example, if I have done a lot of mistakes from the general surgery topic, I may used to make sure that I used to go back to reading my theory from the book which I've been reading so far. So like during my time, I read maximum of Bailey and Love. So I used to read Bailey and Love. And if there were any topics from Sabiston now which were asked, so since I had not read a lot of Sabiston during my general surgery residency days, I used to add those important points from Sabiston which were asked in MCQs in the GTs and add it to my Bailey and Love. So in the end, I was actually reading and re-revising the things which I had been doing from my 3 years of general surgery. So that actually helped me a lot, and it was not a lot of stress that I had to cover a lot of theory or practical. It was much more easier work for me. So like my entire, like I was a part of decathlon series, so like my Berry and Love has almost all the questions that have been asked so far because I used to mark it. So while reading the book, it used to help me revising the same topic again and again. And also the best part was that while you read the book now, you come across those images, and sometimes the images are asked directly from the exam. So that gives you a very good visual memory, and visual memory helps a lot.
Yes.
So I think it's important, like your theory, you can go retrospective. That is that was like a good help to me because at the end of 3 years, we all are general surgeons and we all almost know everything, right? And
Yes.
all know nothing. Like nobody can be master of everything. So you need to just keep revising and solving MCQ like is only an art basically. The one who is the best artist on that day actually wins, right from rank 1 to 5,000. It's all about the art, small minute errors which makes the difference between from rank 1 to rank 5,000 basically.
Yes. So what is important,
So
I
I
think,
will
is
also,
yeah.
yes, sir.
Yeah,
So
please
I'll
go ahead.
also give what a week will look like, what my week looked like. So Monday I used to give a GT in the morning, 10 to 12:30. I used to give a GT. Find what is my bottom three subjects. Maybe my bottom three subjects were always onco, general, and I think breast. So then Monday evening I would study those topics like onco. I targeted onco. I'll take one topic. I'll read about onco. Tuesday morning I would solve MCQs of onco surgery. Then I would solve like 100, 150 questions of onco surgery and 50 questions of some other specialty like normal, which can be like broad specialty. Then again Tuesday evening I'll read about that breast part which I was lacking. So Tuesday I'll solve that. Then Wednesday morning I'll solve MCQ for the breast, and then Thursday, I would give another GT, find which are my 3 weeks zones. So keep on doing MCQs. I used to do MCQs in the morning. You can shift it to the evening, whichever suits you best.
Yes.
But keep on solving MCQs. Be in the MCQ mode. That is very
Yeah.
important. Be in that mode. So you cannot switch off that mode for any time. You cannot afford to switch off that mode. So be in that mode daily, every day. Solve at least 100 MCQs. You can even target 200 MCQs. It is possible. I used to dedicate my afternoon also to solving MCQs, and then in the evening I used to revise those theory parts.
Yeah, so I think what is important to understand is that theory revision, your MCQ revision, and your mock revision all go hand in hand to prepare you for the weak topics and revising your strong topics. So don't think that theory, MCQ solving, and mocks are different. At the end, what is your strategy is to cover up the weak topics and revise the strong topics. So that is what Dr. Yes said. That is a active recall method where you read it today, solve the MCQs after a few days, and on that day which you have read topic of onco, you are solving another questions of another topic which you have read maybe few days back. So that is how your revision should go hand in hand, and your theory revision can be from the synopsis notes of ethos or the rapid revision notes what we are providing, or it can be textbook. It depends on your comfort that what you'll be able to revise minimum twice to thrice before the exam. And MCQ solving should go, according to me, it should go minimum 1 week before the exam. As Dr. Yash was very aggressive, he solved even in the last week. I would advise to just solve the bookmark questions or the tough ones, or at least one GT you can add on. But you need to strategize that what you need to do and what you want to do, because everybody has a different way of reading. But make sure that, as Dr. Yash and Dr. Ayush said, that you solve the MCQs. It can be either retrograde, that is, you solve the MCQs, revise the theory, or you read the theory and do utilize the MCQs for revision. So that is our personal choice, but you need to keep solving MCQs and you need to keep revising. Your theory reading, MCQ practice, mock practice are all multiple forms of revision of that topic. So that is what your mindset should be, or don't treat all three of them differently. Another important thing is that somebody is asking about the reading of Bailey with the notes or only reading textbook. So I think I'll just quickly take this, that it is all about revision of the things what you have read. It should be minimum 2 to 3 times. So next question, what I want to ask both Dr. Yash and Dr. Ayush is, somebody is asking about how many revisions should be done in the last 1 month.
So, like I said, divide the 1 month in two parts. I think only one revision would be possible of the entire of the week zones. I feel one revision would be possible, but the next revision you would only focus on tables and figures and previous year's questions and your week wrong questions in the GT. So that will be sort of a not a complete revision, but you would focus on the high yield MCQs, high yield topics. So that is important.
Yeah, Dr. Aish, your take on the revisions to be done in the last 1 month.
So I think this would vary with individual to individual. So what I did was like, so I'd been giving GTs like from the month of January, and our exam was around September or September end towards. So I'd made a small copy where I used to note down my mistakes and I used to note down the important stuff, right? So during the last month, what I did was I used to keep revising them as frequently as possible, be it every alternate day or be it every day whenever possible. And apart from that, what I'd done was like from 1 month before, I had my textbook of Bailey and Love. So I started reading it from chapter one to chapter last. I started like, let's try completing. So my strategy was to revise my main textbook, which was Bailey and Love. So in retrospect, that Bailey and Love had almost all the important points, questions that had been asked. So that was the target, to revise it once. And every day I used to make revise a small copy. Like I gave you an example before, like examples of clean wound, clean contaminated, contaminated, dirty wound. So those were some important points where I think I used to sometimes make a lot of mistakes, like once in like 4 or 5 GT. So I used to keep revising them and such, like this, some small important tables, even like biostats, p-value, type 1 error, type 2 error. So all these things actually helped me, like around 10 to 15 things which I might have made a silly mistake. It helped me in preventing those, because my small copy I used to keep revising daily. Those were like high yield to be done errors which could have been made by me easily. And rest one revision, I think, reading my textbook. Now obviously I couldn't complete reading the entire textbook, but I did try to cover the most important and major topics like general surgery, endocrine, whatever I could have covered at that time.
Right. So I think it is a very personalized choice about the revision, because it depends on your preparation, but you need to revise at least once or twice. That is a must. More than that, it is always good for you if you can revise more. So another
I
important
think,
thing, yeah.
sir, I think I've been called, so I'll have
Yeah.
to
Please,
leave.
please go ahead. Thank you so
Yeah,
much
yeah.
for
Thank
your
you.
inputs,
Thank you
and
very
thank you
much.
for taking out time. Thank you so much, Dr. Yash.
Definitely. Thank you.
Thank you. Thank you. Another important thing is the last minute revision notes or the rapid revision notes or the ethos series what we are having. So as Dr. Yash mentioned, and also Dr. Ayush can pitch in about this, that if you have time to watch, just use the video of 1 hour daily or 2 hours daily for that revision purposes, so that your topic is covered. so that you don't need to read that again in that week. Because the way I'm taking GIT right now is to make sure that you are revising GIT with me. You're not reading or understanding anything new. So that is the importance of this. And you can utilize the notes to just quickly go through. If I've summarized the liver topic in, let's say, 10 pages, 15 pages of notes, you can just quickly go through, because that is how we have designed it. So you can obviously utilize that. It is important that the rapid revision series covers all the important points. So to make sure that if you are having time to utilize it, please do that. Dr. Ayush, your take on the ethos series for the students who are using or who may use it, just quickly on that how would you advise how to utilize them actually?
So I actually agree with Sir what Sir told. It should be utilized as your revision, right? So don't look at last month for rapid revision series to fetch you all the 150 questions. That's practically impossible. What you should be targeting that after attending this series, you have a good gist of almost all the topics so that you are confident enough to solve all the questions, right? Matlab, like don't go with the aim that this series is going to help me cover all the questions, but go with the aim that ki, yes, after attending and revising this, you will be able to solve that. I think this is one of the major mistake that we do. We look for almost a lot of information. So do not look for a lot of information. Look for what is the most important information for you that is going to help you in your exams.
Yeah, just a second. I think I also have Dr. Satyanarayan with us, who is our Euro faculty and also previous year top ranker, who is now in the final year of urology. So, Dr. Satya, thank you for joining and taking out time. And Dr. Ayush, I think you have to leave. You can leave. Thank you so much for
Yes,
taking out
sir.
time.
Thank you. All the best to everyone.
Thank you.
Thank
Thank
you.
you so much. Yeah. So, Dr. Satya, thank you for joining. So, we have discussed quite a lot of things, but I would definitely like to take your inputs about your tips about how and what students should do to utilize the best in this last 1 month. Give your tips and tricks, because I think you have been taking the ethos series and the surgical scholar test and discussions. So you are in that zone and discussion with the students. So just quickly, you can give your tips for the same. You're muted. Yeah, you're
Uh,
muted. Yeah.
yeah. Hello everyone. How is it going? How is the Josh now? Yeah, it's okay. So this is what everyone faces, even the top rankers or middle rankers or low rankers. Everyone will same this 1 month period as the same. So it doesn't matter to anyone. So what you guys are doing is amazing thing. You have joined the Etho series and you have like almost listened to many important MCQs ahead. So just you continue the work what you are doing now. Okay. So already many points have been like listed out by the other faculties. So you are just continue what you are doing. So your work is you have to sit and you have to spend some time with the book and you have to go through your plan. That's it. Nothing special here. So you have to go through that, revise the like bookmark the like whichever bookmarked MCQs which you thought it is important and your extra notebook which you have written or something. So you don't forget to revise that. And whenever you have like little bit fed up, just open your revise series or TNT series and you just go through it. Like many you guys were asked for like a cardiothoracic pediatric and everything nicely covered by sir actually. So that will be very helpful for you guys. Okay, so no more like no like mistaken MCQs from the cardiology part. Okay, our CTVS part hereafter. Okay, so our ethos students has to score in everything and our Sushruta LGS subscribers has to score everything in like a CTVS part and everything. Please utilize that. Okay, please spend more some time with the difficult part, whichever you want to like reconsider. No, I'm a little bit weak in that part. Just spend 1 or 2 hours of video listening in that part. Otherwise, you just continue your work. It will help you. All the best, everyone.
Yeah. So, Dr. Satya, your take and your tips, and how would you advise students to go about in this last 1 month? I'm taking inputs from Dr. Yas, Dr. Ayush, and yourself. Just give your quick inputs about how and what they should be doing in this last 1 month. We have pretty much covered everything, but your tips about the same.
So no more like new learning of much more topic. Very very important one. Okay, no more new learning. Like now only I am going to study a different book, different. I will take substance part and I will read and take. No no no. That is not like that. Should not be done here. So you just don't forget to revise the thing. Repeatedly revise the things which you have studied already. Like many of the people have just finished the MS. So that time like the first 400 page of Bailey and all you have must nicely covered it. Okay, so you have to go through it. Okay, you should not miss it because you have already read that. So that is what I didn't make a mistake. I did that prepared nicely. Then the super specialty topics, because you guys more like much more think about the GIT part, but the super specialty will part will come and surprise you. Okay, like many of the like image based, like just whenever you are tired, just scroll down. Even Sushruta LGS also we have videos of image based and table based questions also. Like some of the 20 minutes videos are there. You can just like in between time you can go through that. So I'll just open the book and go through the images of Sebastian. Okay, it will definitely help. Okay, like that time itself you will learn some more like a theory part you might have studied that, but in picture based questions it will enhance the time to decrease your like a 45 seconds. It will decrease your time to 20 seconds where you can spend the time for another MCQ. So that is very important thing. Okay, because no like very less number of MCQs will be directly on the MCQ based and state MCQ will come. So most of the time they will give the description, but this image based question that will it will help you to shorten the MCQ period of time. Okay, that is very important. And coming to the revision part, just try to revise on what you have already read. No more new topics. Okay, just whenever you got like tired, yes, as I told that you can just go through the like a SWOTs part of like a urology. If you want to see, you can just open and you can see that. Or if you want a cardiology part of SWOTs, then you can just go through that. At least like around 100 MCQs will cover up in that period. Okay, so that is very very important. Just relax yourself. You are doing already a very good job. So just be consistent with that. That will be enough.
Yeah, so Dr. Satya, thank you. That is a very important thing which you mentioned, that if you have time, just go through the images. That is for the visual memory about the image-based question, because last year quite many were directly from Bailey and Sebastian. So that is something which every student needs to keep in mind. Another important thing is that student has asked that by the time they come to the last section of the NEET essays, like in the actual exam, they feel burnout. So before I ask you, I'll give input and I'll advise all of you that try meditating and try giving the mock exams, the GTs, so that you are accustomed to sitting for 2.5 hours, because actually NEET tests is very tiring. 2.5 hours sitting, concentrating fully, anxiety, everything gets mixed. So what is your tip, Dr. Satya, to deal with that? Because that is something which many students feel, not just during the exam, but also during the GTs, because by the time they come to the last 50 questions, they get burnt out. So what is your tips for that? Tip for that?
So that is, I feel like you guys should be like a very self-confident. Like many of you people are working as a consultant, you are doing obvious like awesome surgeries ahead. But sir, now I'm doing surgeries, then like now I have to sit and study for this time. No, 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 that is not like that. Everyone can sit and study. Okay, that is the confidence, self-confidence, and motivation you should have. Okay, as I told, like meditation can help. Even repeatedly, you tell yourself that some kind of this self-confidence and motivation is very self-motivation is very, very important. Yes, you can do it easily because all other people over the India are doing it. Okay, then why can't you? You have put so much effort to learning for like a TND sessions and the ETO series, rapid revisions. You have put so much effort. So this efforts will never go in vain. Okay, the hard work will truly will give you the fruitful result. Okay, so just trust yourself. Just like be what you are like do whatever you write like according to your plan. You stick to that. That will definitely help you. Be motivated. Be motivated.
Yeah, so that is very important thing, that you need to be motivated. You need to feel confident, no matter how much you have read. If you are feeling confident that, okay, whatever I read, I have given my 100%, I will guarantee you that by the time you come during the exam hall, whatever question is asked from what you have read, you will answer them. Whatever question is asked from the topic which you have not read, if you apply your concept, if you are calm, you'll be able to answer them. So that is a very important thing, what all students should keep in mind in this last 1 month. So lastly, before we end here, Dr. Satya, about the revision, about what you did or what they should be doing in this last 1 month, like daily, weekly, just quickly your inputs, and just last few words of motivation for all of them.
Yeah. So according to the revision, yes, it has to be a chapter-wise revision. Okay, chapter-wise revision has to be done. Like it can be coordinate with the Bailey and so if you have studied the Bailey and subsistent part together, okay, already like you have underlined. Okay, like many of the people like must not have read some of the topics, but when you have studied, okay, try to combine the same topics. Like if you do the revision of this one and do the revision of this one. But even the rapid, if you are following the rapid revision itself, that is enough. Don't do any new things. Just stick to that. You have to remember the things and at the last minute and like ARB and you have to attend the most of the questions of like MCQs, then only you are giving some chance to get some more marks. Okay, so you have to attend the maximum number of questions. Then revision part, yes, as everyone has told that like stick to the basic and continue our topics reviewing with the images. Then like bookmark MCQs you should not forget, and the extra note which you have made it, that is also you should not forget. That's it, sir. And another one more important thing is don't expect the result. Okay, don't expect any good results. When the expectation is coming to you, that is where like what if I didn't get? What if I don't get the college? So that is what give you depression. Okay, or it will pull you down. So don't just like expect things. You just go to your target. What is your job? My job is to sit and study. Yeah, I will do that. Okay, I'm not expecting anything because that will come to you. Okay, that will come to you. So don't expect anything. But the thing what you should have in your mind is I'll give my 100% whether I don't care about the result. That is what you should always listen. I will give my 100%. I don't worry about the result. Okay, that's it, sir. Thank you.
Yeah. So to conclude the session, what I will advise all of you is that Sri Krishna has told that just work hard, just focus on the process, on the hard work. Don't worry about what is going to happen. Don't worry about the result. So that is what you need to do right now. As Dr. Satya also mentioned, that you need to concentrate right now on that. If you have chosen to appear for NEET tests, no matter you decided 6 months back or you decided today, you need to give your 200%. That is one. Second thing, you need to stick to your choice that I want to give exam properly. You have to be sincere in your process of reading. You need to be sincere with yourself that when you come out of the exam hall, you should be satisfied that yes, I have given my 200%. Now, whatever happens will be my destiny. So if you give your 200%, you can definitely do it. Don't worry about whether I've read PDA, whether I've read CTVS, I've not read it. Whatever you are reading right now, focus on that. Try to revise them, whatever you're reading. Don't read anything new right now. Solve MCQs daily. Utilize theory, rapid revision, notes, MCQs, mock exams as a complete source of revision, not separately. Focus on the topics which you are feeling weak in. Solve mock exams. Be prepared in the mindset of giving 2.5 hours, 50 section based exam. Meditate daily. Be calm. When you sit in front of the monitor in the exam, you don't have any clock. You don't know what is the time, what is going to happen. Just sit, close your eyes, think about, yes, I have prepared. I have done my best. Now I cannot do more than this. Now I can just give my 100% towards the exam. So just focus on that. That is what will help you to achieve the rank. So with that, I think we'll conclude this session. I'll thank Dr. Yash, Dr. Ayush, and Dr. Satya again for joining and giving the valuable insight, because more than what we teach about GIT or Euro or whatever subjects, it is more about how you can achieve this, how you need to go about, because this is something which you all need in this last 1 month. So that is it for this session. So thank you all. Thank you, Dr. Satya again. I think I don't see any more questions here. If anybody has any question, they can mention in the group, WhatsApp group of us, and we'll be able to address them there. So with that, we'll close the session now, and all the best to all of you, and hope you all get the desired rank what you want.